Hello, my name is Amy Sturkey. I'm a pediatric physical therapist, and we are on part 2 of 2 videos on dyspraxia, developmental dyspraxia specifically. If you haven't watched the first video, I would recommend you watch that one first, and then watch this one. So Whitney Choi and I are talking about dyspraxia, and I'll let her introduce herself.
Hello, I'm Whitney, and I have athetoid, cerebral palsy, and dyspraxia.
So what are the causes of dyspraxia? Well, unfortunately, that is just basically unknown at this time. They think that dyspraxia is caused by poor organization in the connections of the brain from one area of the other. The brain really has multiple centers of specialization, and there has to be good connections and coordination between the different areas of the brain to do really any activity. So people who have dyspraxia, their brain takes more time to process information than the typical person does. And again, here we're talking about developmental dyspraxia. Dyspraxia can also be caused in adults when they have an injury to the brain from an illness or an injury or a stroke.
How is dyspraxia diagnosed? No specific test or brain scan can be performed to identify dyspraxia positively. It is diagnosed by ruling out other conditions, such as cerebral palsy or muscular dystrophy, as causative factors for the child's actions or behavior. Dyspraxia is more likely to occur if a child is born before the 37th week of pregnancy, and especially if before the 32 weeks is born at less than 4 pounds. Has a family member with dyspraxia or a developmental coordination disorder.
Okay, so you might be wondering, what are the criteria upon which you can get a diagnosis of developmental dyspraxia? Well, a couple of things have to occur. First, the movement skills of the child have to be below the level that are expected for the child's age. The delays or deficits have to affect the child's daily life or their achievement in school. For developmental dyspraxia to be diagnosed, it has to happen early in life. And then lastly, other medical conditions can't better explain the difficulties that the child is having.
However, please note individuals with cerebral palsy or other conditions can have dyspraxia in addition to their other diagnoses. Children are often not diagnosed with dyspraxia until they are 5 years of age. Because rates of development in children vary widely, this condition is often missed until kindergarten age or older. Diagnosing a child younger allows them to get the physical, learning, social, and emotional support they need to thrive earlier.
So, who diagnoses dyspraxia? Well, a knowledgeable doctor or pediatrician can diagnose dyspraxia, so can a neurologist, but often it's physical therapists, occupational therapists, and speech therapists who, as they do testing, realize that a child is having trouble planning and organizing movements of their mouth, hands, or whole body, and they're the ones that end up diagnosing developmental dyspraxia.
What percentage of people have dyspraxia? Somewhere between 5 and 10% of people have dyspraxia, and about 2% have it severely. 80% of people diagnosed with dyspraxia are boys. However, some studies report that girls are underreported or simply get diagnosed later. Problems with dyspraxia typically continue into the teenage years and adulthood.
Well, how do you treat dyspraxia, then you might be asking? Well, dyspraxia may get better over time, but in most cases, treatment is required to assist the child to learn to plan and execute movements better. What you really need to do is get an evaluation done to find out how your child is affected and what then would be the best specialist to be able to help. If it's a physical therapist or an occupational therapist or a speech therapist, it might be that applied behavioral analysis might assist your child best. It might be that help from a developmental behavioral pediatrician would be best. There's also research that says hippotherapy, that's not riding hippos but riding horses, are effective treatment as well. Medication management may help as well.
Cognitive behavioral therapists, counselors, and psychologists can help change how children think about and act toward their challenges by improving self-esteem, stress management, and coping strategies.
So some children may need minimal or not very much intervention, and other children may need more extensive intervention. So one of the most common ways of working with a dyspraxia is task-specific intervention. So the therapist may help a child look at a task and see what's challenging about it and directly tackle that specific task that a child is having difficulty with. Another way that dyspraxia may be treated is adapting tasks. For example, if a child is having trouble figuring out how to hold a pencil, that they might use a pencil grip to help them hold the pencil better. If they're having trouble learning to ride a bike, they may use training wheels or move to an adult tricycle or a larger tricycle. Instead of being on 2 wheels, try 3 wheels. Another way is that a task may be broken down into smaller pieces, and each small piece of the task can be practiced over and over and over, and then the whole thing is put together to be able to do the whole task. No matter how you treat dyspraxia, often the answer revolves around repetition and lots of practice.
Schools and clinics can provide therapy. Schools can also make accommodations to make learning less challenging. If your child is eligible, the school may develop an individualized education plan for your child to help him learn.
It's important to remember that active play is powerful and essential for children. That could be in the yard, in the neighborhood, in the home, on the playground. It doesn't matter where. Active play is so crucial. And active movement is particularly crucial for children 3 to 5 years of age. Not that it's not important later, but in that time frame, it's really important that kids are out and moving. You have to remember that play is the work of children. This is what they're supposed to be doing, not sitting around, but getting up and moving. It's how they learn to coordinate their bodies and move it through space and develop spatial awareness and the way to sequence and time activities and to be able to play interactively with others.
Even if an individual has trouble moving, it is essential. It is not too late for change, even for adults with dyspraxia. The brain changes the quickest to intervention when dyspraxia is treated early, but changes can still happen with treatment into adulthood. Adults with dyspraxia can engage in therapies or get a personal trainer to help them develop a healthy exercise or movement plan.
So you might be asking, are there other things that go along with dyspraxia? If a child has dyspraxia, are there things that they might also have? Well, that's true. About 50% of children who have dyspraxia also have attention deficit disorder, ADHD. They often have language problems, and I have seen that in my treatment of children with autism that just about all of them are severely dyspraxic. Children on the autistic spectrum have a really hard time performing activities on request or in imitation. They have difficulty if they're in my room and I do an evaluation for me to be able to show them what to do, and then they do it.
Dyspraxia or difficulty writing. Dyslexia affecting reading and reading comprehension. Dyscalculia affecting the understanding of numbers and quantity. Slow processing speed. Sensory processing disorder. Mental health issues, like anxiety, depression, sleep disturbances, and compulsions.
It's very important to remember that no two people with dyspraxia are exactly the same. Evaluations are critical to determine what is the best treatment approach for your child and what's the best areas to focus on. Is it physical and occupational therapy, or is it ABA and speech therapy? What's best for your child, or if it's just one discipline? And then it's also extremely important that parents advocate for their child as they grow in the home, in the school, in the community to get the support and understanding for their child's condition as they try to navigate life.
Individuals with dyspraxia get older. They must advocate for themselves to get the help and modifications needed to thrive. The general public is often unaware of dyspraxia, so parents and individuals may need to help educate others about the condition.
I hope going over this information about dyspraxia has been helpful for you. I have loved having Whitney join us, since she is someone who life has been really affected by having dyspraxia, I think that makes it more personable and meaningful to people as they listen to her. Whitney, maybe you could tell us how your life has been affected by having dyspraxia.
Dyspraxia has affected my life almost in every area of my life, but the most difficult part of it is probably having any relationships I encounter, because not only do I kind of have a severe form of it, but I have cerebral palsy, which affects my speech.
Thank you, Whitney. Goodbye, everybody. See you next time. Bye-bye.
It was really fun making this educational content, and I really hope people this helpful. Bye!
If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.